Yeah, no more.
Oh, you turned it on?
No more doing stuff like you did on Buzz's show.
Oh, I gotta show you that.
No more cray.
What'd you do?
I'm back there talking to her about something, and I'll show you the video. But Buzz sees it in the corner and then tells me, like, this is not good. I'm like, when you see it, you'll know what I mean. You gotta be careful when you're on live. Hi.
Oh, you were having a naughty discussion or something?
Oh, yeah?
Naughty.
Looked like I was rolling dough.
We won't discuss it here. We'll just tell you later.
Was I sitting in here?
Yeah.
Oh, okay. I probably wasn't even paying attention.
No, your back was turned.
Yeah.
Thank God.
Then you guys were getting jiggy with it.
Oh,
Okay.
it definitely was. I even went Euro style. Pinky up.
Euro style.
All right, so you got to kick us off.
Hang on just a minute.
Well, I need to see the point.
I know. I just want to. Okay. Oh, she's a pro already after 3 shows. All right.
She is. Are you ready?
Yes.
Ping
Okay.
ping.
Welcome to the River Park Dental Show. I'm Dr. Phing Saurer, and I'm here today with Michael Morris.
Ping, it's good to see you again.
It's good to see you.
And as always, we're on Facebook Live, so if you're watching this now, hello. If you're watching or listening on Sunday, you can watch this later on YouTube, right?
Yes.
You guys were using the YouTube last week, weren't you? I think Ellen was trying to make... Don't say the YouTube. That's like when people say the Facebook.
I joined the Facebook last year.
Nope, it's just Facebook.
And the Instagram.
No.
So it is the YouTube.
You have to take the part out. That makes you sound like when my grandfather would say, I joined the YouTubes.
I am essentially like a grandfather joining the YouTube.
Okay, you're still saying it.
Well.
Anyway, the point of it was you can watch any of these shows on the Morris Media Productions channel on YouTube, so you can see Dr. Phing. If you've never seen her in all her 5-foot glory, you can actually see what she looks like if you don't go to River Park Dental, right?
Yeah, or you can go to our website, look at some pictures
That's
there.
where you're supposed to say you should come into River Park Dental.
Come in. Yes, do everything. Come in, check us out.
Get a Sonicare brush.
Get some, and gift cards to, I don't actually remember, the Ram, local cantina.
The guy who we're going to talk to in a couple hours listed like there's 9 restaurants right outside River Park Dental, and I think 7 of them are not open.
Yeah, well, they're going to be open this spring, summer, so it's coming. It's coming. The calories are coming.
So they can get their teeth cleaned first and then go eat.
Yeah,
okay.
or eat and then come get your teeth cleaned.
Does that bother you, by the way? Like when someone eats or drinks or something?
I'm not the one doing it. So
that's true. So the hygienists probably don't care.
No, well.
Or you don't care about hygienists. Which part is it?
I don't think they care. They don't.
I'm pretty sure they care.
So go eat and then get your teeth cleaned.
Okay.
Or vice versa. We don't care.
I like that you make decisions and you stick to them. Either way, whatevs. I think we should get into our topic since last week we started with Pretty in Pink and I hadn't seen it. This week, I thought this was important because this was just a day ago. Sugary drinks lead to obesity, dental problems, and possibly early death. Which one would you like to address first?
Oh, my.
I think we could peel off the early death thing.
Yeah.
To be honest.
Yeah,
So, but I thought this was a really important article because when we were researching things for the show, I wanted to get your take on the amount of sugary drinks that people, I know that you're dealing with all age groups, but are you seeing a lot of that? Because I get warned every single Sunday at my family dinner that we have to stop drinking Mountain Dew. From people that are not dentists, by the way.
Yeah, Mountain Dew is one of the most...
It is an amazing drink.
Well,
no, it's not good, is what you're saying.
It's not good for your teeth, but it's
good.
Good to keep you awake.
Okay, so we're not hating on Mountain Dew. You're just not supposed to have that if you want teeth.
Well, no. So I am not opposed to sugar. It's just how you're drinking the sugar. So if you're just like pounding that Mountain Dew in 2 minutes, that's not a problem. But if you're drinking that one can throughout the entire day, you're just kind of like making a sugar bath for the bacteria in your mouth and just causing the cavities. Feeding the cavities. The bacteria that makes the cavities.
Is that the same thing with Gatorade?
Yes.
Because it's the amount of sugars.
Yes.
Explain how that breaks.
When they have their mouth guards and they're drinking that Gatorade, and that Gatorade's just swimming in that mouth guard, and then they're just feeding that bacteria.
We should have probably started and said if you're eating while you're watching or listening to this, probably not a good idea. I forgot we were going to talk about bacteria.
Is this disgusting? I don't think so.
No, not to the average person just driving around. No, it's fine. But what is it that leads to that? So you have bacteria already in your mouth, right? So this is just like compounding it.
Yeah. Well, I mean, yeah, you have a lot of bacteria, but there are bacteria that causes the cavities. And so if you're drinking a lot of sugar, and that's just kind of basically continually feeding them. So if you want to drink the sugar, that's fine, but just drink it quickly, and then, you know, rinse out your mouth with some water, neutralize everything, and it's fine, and then brush regularly.
Can you tell when somebody is like just addicted to just hammering sugar all day?
Yeah.
Like when they come, so you can tell?
Yeah.
And you judge them,
can.
don't you?
No.
Oh, no,
I don't
no
judge
judgment.
them, but, you know, you can tell. So
But do you give that? Do you say things? Do you say like, you know, you might want to cut back on your sugar intake, or drink, like, do you drink a lot of soda?
I think a lot of people know, though. It's not like they try to lie about it. So they are aware. You know, it's like, you know that smoking's bad, but people will still do it.
I've not heard that. I mean, I don't read a lot of research about it, but smoking might not be that bad.
You've never heard that?
Well, I do think that I've heard so many things about the amount of sugar. Because have you ever seen the documentary that Katie Couric did that I just forgot the name of? Let's just say you have.
I haven't seen. I don't watch TV.
I'm sorry.
You know,
I know you're
we're
busy.
talking about movies.
You're
and
touching
TV
molars all day.
and-
I understand. But what in this documentary, which I'll probably remember as soon as the show's over, they were talking about the amount of sugar in our foods and how, I think it's by 2035, 50% of children will have diabetes because of the amount of sugar in the foods that we're eating.
That's probably true.
So you see this, and as a clinician, you have to look at this because, as we've said before, you're a doctor.
And yeah,
Right?
that's true.
So you see this, do you feel that you need to kind of step in and tell parents about this, or kids, like, you might want to cut this back because this is
No,
totally
we
unhealthy?
definitely advise, you know, and I think parents are aware, but I think they need to try to find that balance too between, because I don't think you should just completely take things out of your life. You know, you need to enjoy things. You just have to do it in moderation. And I think that's what they need to teach their kids. Because I think sometimes if you cut back and you don't let them have it, they want it more.
Right.
So, you know, let the treats happen, but just make sure that they're eating it moderately, and then also the preventative care, like the brushing and the flossing and doing all that stuff too.
Is this why you give away that sugar-free candy that's terrible at your office?
Yes, yeah.
That was a nice treat to give us the first time we met.
Oh, did you like
It was not. I immediately went out and ate some real candy.
No, it was good.
Rachel liked it, but Rachel's like, she's eating like
but
one mint a
she
day.
also has like 10.
Jim likes it. Jim's off mic and Jim likes it, so it's fine.
Oh, could you bring one for Jim? How
I
many
did not.
did you take from my office?
It's not that I take the candy from your
Oh, my
office.
Goodness.
We were trying to use that coffee
We were
machine that looked like
running
the
low.
Titanic in
Now
the
I
front of
know
the
why.
office. Well, we didn't know what we were doing. So when you're looking at these patients that are coming in, like you're just going to tell them like maybe cut back. You're not going to tell them to restrict it totally.
No, you don't have to completely restrict anything. But yes, cut back for sure.
I just think it's weird that you can actually see it. Like you actually can tell when someone gets in that chair.
Yeah, I mean, because they have a lot of cavities, right? And then it's like, and you can tell when people aren't flossing because they have a lot of the cavities in between their teeth where you're supposed to floss and wash. Break things out. So you can kind of, like,
They have cavities in between their teeth?
yeah.
How is that?
What do you mean, how is that?
Well, I mean, you're a dentist, so how do you get cavities in between your teeth is what I'm asking. I didn't even know that was a thing. I'm not a
I'd have to
dentist,
show
Phing.
you an X-ray then. I
Please
can't
don't.
explain
I can't
it.
look at those x-rays.
Have
They're
you
gross.
eaten yet?
Have I? No.
well,
And I will
won't
not go
show
back to the
you.
office with you. I'm just trying to point out. I didn't even know that. I don't know how many people actually know you can get.
Yeah, because food gets in between your teeth. You know, that's why we promote flossing, because that helps clean in between your teeth. And then after that, but if you're not, the food gets stuck there, defeats the bacteria, causes the cavities. But fluoride will help, flossing will help.
So when you're looking at patients that you get in, do you see, I'm not saying like name people, but with the obesity rate that's, if you're looking at, is going up year after year.
Yeah.
So you're seeing that and you know where that's attributed to. It's not just a lack of exercise, it's what they're eating. Do you see that people's eating habits are kind of, I mean, are you because you are a doctor, do you see that there's some things you need to kind of, like you're concerned about and you relay to the parents or the person that's in that chair? Because I would think it would be one of those things like you are a clinician, so I would think you would say...
no, we definitely pay attention to the whole thing. So, you know, if they're overweight or they have high blood pressure or they have diabetes or anything, you know, we're paying attention to that. And then we do make recommendations if their blood sugar is high or their blood pressure is high or, you know, I don't really it's just living a healthy lifestyle. So we're not saying, oh, you know, you're obese. I'm not making those kind of diagnoses.
I would
at all.
hope not. What? That's no bedside manner. Listen,
No.
you're a biggin. Like who would lead with that?
Biggin.
Yeah.
What?
You know, you're a big one, like a biggin.
Hmm.
Yeah. Don't use that later. That's not something you would say.
No, I would not use that. I didn't know that's a technical term I've never heard of.
It is a technical term. I like to use it a lot of times as it comes along. So as you know, you're going down this path. You've got somebody that you can tell is not living a healthy lifestyle.
Yeah.
You're not going to badger them, but you are going to kind of point out some things.
Yeah.
How would you know? Do you get their medical history as well? Because you said if they have high
Yes.
blood pressure and diabetes, so
We take their blood pressure. We take.
Do you really?
Yeah.
I've never had that, and all the times I've gone to the dentist, I've never had that.
Really?
No.
Well, I mean, we take it. We want to make sure that it's not overly high, because if we ever have to use anesthetic, we want to be careful. So we do that. We take an extensive health history. I don't know what else. Yeah, you take the whole overall thing. So you just want to make sure they're healthy.
Where did you? That's got to be a new thing, because honestly, like
No.
I've never had that done.
I did it all through dental school.
Well, I don't know that you need to brag about it. I'm just
Well.
saying. No, I had no idea, because I was wondering what would happen if somebody had an emergency in that chair, like a health emergency. Like you have to be prepared for that, right?
Yes.
Or the hygienist just runs out of the room and makes a phone call.
Well, no, we're all prepared. So we all have our basic life support training. But then I also have my ACLS and then my IV sedation training. So I can do a little bit more than that. But of course you call 911 too. I'm not delivering babies or doing anything crazy or, you know, doing
Could you
bypass
deliver a baby?
surgery.
Now you just
I could probably. Yeah, sure, why not? Let's just boil some water, right? That's all you need.
I think that's all they
Some
did in
towels
the 1800s.
and-
But if
I have
they,
a scalpel, like it's good.
would you give them a gift card?
Yeah, maybe
To the
two.
Rand?
I'd probably give them two.
Yeah.
Because then, you know, if they leave with two people,
I'm just gonna say this: if you deliver a baby, we should probably do a show on that.
if that ever happens, which will be never.
Yeah, put that on Instagram though. That'd be awesome.
Yeah.
Can you imagine? They'd be so
People
grateful.
love the pictures.
They would
yeah.
call that baby Little Ping.
Um,
Boy or girl, it wouldn't matter.
It is a unisex name.
Yeah, it's spelled Phing, which when I first read it, I'm like,
Phing.
yeah, I just didn't say your name.
Oh. What did you call me then?
I was like, hey doc, how are you?
Oh, okay.
And you just sat there, menacing, looking out the window, just not smiling at all. That was a good look for a dental person. I'm not going to
Brooding.
smile.
Was I like just in the...
Yeah. It was like so dismissive, and yet here we are doing this. My nightmare continues. So I want to get back on track because you're getting me off track.
Sorry.
So obesity leads to dental problems. How do you see that? And I know we're going to have to take a break here shortly, but could you give me kind of like what you see the obesity kind of leads to? I mean, obviously cavities.
Yeah, I mean, I guess I'm not sure what you're trying to ask me. Like,
Well, first of all, what I'm saying
can
is...
you rephrase that, but in a way
like
I
a
can
spelling bee?
understand?
Can you use it in a sentence? What I'm saying is if you have dental issues, if you have obesity, chances are you're eating more sugar, right?
Yeah.
Which is leading to more cavities, which is leading to more gum disease, periodontal disease, things like that.
Okay.
Yeah, I studied.
Yeah.
I did some
You
research.
just said periodontal disease. That's
Yeah.
pretty good.
Well, you also said you could deliver a baby. So I just want to point out I am
In
also
theory, I'm not saying I can.
prepared. I'm not saying you should. But what I'm getting to is I want to know, what do you see in people's bodies? Because everything kind of starts with and ends with your mouth, right? I mean, whatever you're putting in your mouth is affecting your
Yeah.
whole system. So it is affecting if you have gum disease, your mouth is bleeding, whatever it might be. Eventually, it's going to lead to how you're eating.
Right. So I think that there's a lot of factors into it. So yes, the bacteria in your mouth, they have found that it can be found in the people with heart disease. You know, so it's been found in stuff like that. But I would be careful to say it causes it. So I think it's
But it could be a contributing factor.
it is a contributing factor. But then that also leads to people, then they might not be exercising, you know, and they might not be eating properly, and that all contributes to it. So I think it's that overall general health, and starting with the mouth would probably help immensely, but then it's also they have to do the other things like eating healthier, exercising, doing all those things as well. So it's just a combination of everything.
It's amazing we actually got to that point right before the break. Like, I was hanging on
Well,
for
you
dear life.
rephrased the question.
I'm a good
So I
rephraser.
understood.
I'm a good rephraser. Let's take a break right here, and we'll be right back. You're listening to the River Park Dental Show. You delivered the guy exactly where I wanted you to get.
Okay,
I'm like,
'cause I
how am I
like-
saying this wrong?
You just
Because I was
had
trying to
it
get the
right.
heart disease and plaque, and because that's what I see a lot of this research is like, if you have that plaque and you don't get rid of it, you can eventually ingest it and then have throat issues. What do you call it when you have like a oh shit, what's it called when you have throat issues? You know what I mean, where it's starting to like decay. It's not throat cancer, but I'm trying to think what that other shit is called. Anyway, fuck it.
You have issues in your throat, maybe issues in your lungs. If you're obese, you've got probably
Yeah,
joint
where's-
problems and
where's the
pain,
There's a
Sure.
lot.
right?
There's a lot of things.
Yeah, can you name them
Yeah.
those things?
No.
Why? No, you could.
I can't.
Are you unable? Oh, don't worry about it then. That's not the point. It doesn't matter if you nail all of it.
I'm nailing none of it.
You're killing this right now. You are killing it.
Oh, you're doing fine. It's you got about 11 minutes to go, and this time I'll remember to turn on the timer.
So were you just counting over there?
No, I was looking at the timer.
That would be awesome if Jim was
I
like,
was looking at the timer on the
1,000,
computer.
Yeah.
1,000,
3,
1,000.
if we had a problem,
1
I'm like,
minute.
Jim, and he's like, no, I'm at 19 minutes.
No, I'll give you a 5, 4, 3, 2.
What is this?
Sandy's True Value in West Virginia.
Oh, is this for other shows?
No, this is for you. All right, I want to go, let's do this. If you extract those teeth, especially in the back, losing space for permanent teeth, like I'm going to go into that.
For the child?
Yeah, and I want you to kind of like lead me into child care. Like, I want you to give me, like, think of a specific case that you've had where you've had to do so much work on one person. Do you know what I mean? Like, if you had a kid, then you're like, I can tell you're malnourished and that kind of thing, and then here's,
Or your parents didn't take you to the dentist?
yeah, or they didn't take you to SeaWorld,
I
whatever
don't
it is.
treat that many kind of kids, though. Most of the kids
Not
I
now, because
see-
you're in a real richy area.
I'm in Dublin.
Yeah, people there are still trash, it's
What are
fine.
you talking about? Like
You're
when I
not
was
in the hood
Guatemala?
where kids
But
don't
people even
go to
there
the dentist.
Took care of their kids.
It doesn't not make it up. I'm just kidding. Don't lie.
No, that's a lie.
I'm just saying in general, where can we go with this? Okay.
I guess I meant kids' mouth. Yes, I meant kids' mouth, but I don't treat them that like.
Right, you're not putting like all in fours in their mouth. I know that.
No, but like, so with kids' mouths, when I go there, it's like I don't see the same patients because it's
Right.
volunteer dentists. So like, I might see them for one tooth, but then the next time, another dentist sees them for another tooth. So it's I come into a case, but I never see a comprehensive case because it's a clinic.
That's a charity thing, or no?
It's a-
That's where you
it's a-
volunteer.
It's a volunteer clinic.
We'll talk about that.
Okay.
And we'll just make it up as we go. When you come back,
Well, maybe
and
you should try to prep me next time.
I don't have to. You're a doctor,
Reintroduce
don't
her.
you? You're better when I don't get, because I know you do. And then this, the research general. So what I want you to do is I want you to bring us back, and then I want to get into this volunteer work,
Okay.
and then we'll go there. But I want you to hit the website and the phone number.
Okay, the phone number.
Yeah. So if you don't, you can at least hit the website. If you can't
I know.
remember the number, that's fine.
Do you need to write the phone number down
No,
and have it on
I
a piece of
know it.
paper?
I know
Oh,
it.
okay.
I know it.
All right, she's
I'll
gonna
give off myself.
yeah, get out yourself, and that'd be great in case you need to deliver a baby. All right,
You could probably do that if some woman was in the dental chair. My water broke.
I'd watch that
I'm
if,
going
I,
into
if
labor.
I had a free lunch
I'd
come out
probably
of
run
it.
out and say, Ellen,
I
I
think
need
that-
you to take care of
That
this.
happened to Seth Meyers.
Yeah, I just
Is-
read that.
I saw
What?
that on.
He delivered a baby?
Mike
His
Greenberg
wife
was
had a
talking
baby
about
in the
that.
lobby.
He delivered his wife's baby while their Uber was not running on time. It didn't show
Oh,
up
it was
on
in the
time.
lobby of
yeah, in
their-
the lobby of their
Calls an
apartment in
Uber when
Manhattan.
you're having a baby.
Yeah, that's true.
He called Uber.
That guy makes
Well,
like
you
$5
live
million
in-
a
you live
year.
in
Call
New-
a taxi.
I would be really upset if
He'd
that
probably
was
have
an
his
Uber
own car
driver.
service. You'd think he'd have his own limo.
I know, he should.
You think the network would have their own limo to send over there?
He's probably not a real celebrity then.
He's not. He's a writer who happens to be on television.
God.
He has his own show, but it's on at like 1 a.m.
Who's
So-
staying up to watch that?
Who's watching this?
No.
Insomniacs, that's it. Drug addicts and alcoholics.
People on meth that really like sketch comedy.
Exactly. Ready to roll?
Yep.
Okay, here we go.
Welcome back to the River Park Dental Show. This is Dr. Phing Saurer with Michael Morris.
Phing, if people want to get a hold of you at River Park Dental, how would they do so?
They can come to our website at riverparkdental.com or call us at 614-689-8686.
Getting back to our conversation about sugary drinks leading to obesity, and as this article says, and leading to possible death. Okay?
That's a very serious title.
Well, that's what drew
It's
my
scary,
attention to
yeah.
it, because I thought, cool. It ends really big. There's a big crescendo at the end. So I want to talk about something a little bit more uplifting than that, because we were kind of talking in general about obesity and dental issues, and we were kind of getting on the subject of children. You do volunteer work with an organization already, so you are dealing with children of all ages there too, right?
Yes. So I volunteer pretty regularly at Kid Smiles on Bethel Road, and it basically offers dental care for children, and you have to qualify for it, but it's $10 a visit, so it's affordable for parents to come and bring them in, and then they get hygiene, and then if they have any issues, then they can come and see the dentist for work. And so yeah, I see a lot of different kids there, and it's
$10 a kid.
per child, I think. Yeah.
Let's just say that, and let's see if that works.
Yeah, but just it's Kid Smiles. So if you ever want to donate and money and stuff to that organization, it's great, because I do volunteer my time Friday afternoons when I'm not working.
When you see these kids that are coming in, these are obviously people that can't afford dental care or have health care limitations.
But they still care about their kids.
Well, that's what you were saying during the break, is they still care about their kids. So what is it you're seeing in those kids? Because if you can't afford dental care, you're probably not eating the healthiest. You're probably not, it's not a salad or celery snack type of family. Are you seeing a lot more kids that are having issues where you can see the development of diabetes? Not that you're diagnosing it, but you can see that there's health issues there.
Potentially. I guess you're right. I'm not diagnosing, but they do. Yeah, there's definitely potential there with diabetics or obesity going on to that, but they do have a lot of decay too, where we do actually have to do extractions. I try to do as many fillings as I can so that we can avoid those kind of procedures, but sometimes it's inevitable.
What age are you doing those extractions? Is it 4 to 6? Is it 6 to 10? I know it's different in every case, but there's got to be some.
They can be really young, So sometimes if the tooth is what we call, if it's just completely gone, bombed out.
That's an awesome term, actually. You call it bombed out.
Yeah.
Not to them. You don't go.
No, I'm like,
"Listen,
your tooth is bombed out.
Your mouth is totally Iraq right now. No, I wasn't sure if, when you're seeing that, you're not diagnosing them overall, you're treating them.
Yeah.
But you're trying to save the tooth to begin with, right?
You want to, especially baby teeth, because they are they hold the place for the adult tooth. So I always kind of compare it to Pac-Man. So the little roots, the little Pac-Man, the adult tooth is like Pac-Man, and it eats the baby root and to find its way up to the top. Isn't that a good analogy?
That is a really good analogy. I think you mean more like Dig Dug. But
I don't know. I wasn't born here.
That is true. Yeah, but you were born, at least you knew Pac-Man. I give you that.
Okay.
But
yeah.
that is a great analogy that it is making its way up.
Root. Yeah, it chases the root to come up.
That's pretty brilliant. I think everybody will get that reference. So when you are treating these kids, you kind of are seeing both worlds, right? You're seeing the people that don't have health insurance that need this care, but in Dublin, you've got a whole other set of people, right?
Yeah, the people that want more aesthetics.
But it doesn't matter. Well, the aesthetic thing, I think, is I don't know how new it is to dentistry, but I'm seeing a lot more people pushing it.
With kids, you mean, or just
no. I mean like
or
adults.
Adults wanting it.
Yeah, I see so many people that are pushing for the aesthetically pleasing part.
Yeah, it's kind of funny. Sometimes I'll have patients come in and they have a lot of cavities, but they just want to whiten their teeth. I was like,
right, they want it to look good. It's not functional, but it looks good in a picture.
Well, I'm like, it's gonna hurt, if you have this cavity, and we're gonna put, we need to focus on other things. Granted, I'll eventually whiten their teeth, but I do want them to focus on taking care of the health of their teeth first before we work on the aesthetics.
That's going to be a hard conversation to have, where it's like, I know what you want, but we've got to treat this because again, you got to save that tooth.
Yeah, you just educate. You just give them as much information as you can.
Is the patient always right? Can they say, "No, I'm not doing that. This is what I'm going to pay for"?
Yeah, I mean, like, I'll do as much as I can, but sometimes it goes beyond the standard of care. And if it's something that is not the standard of care, then I won't do it. I will just say this is not something I can do. It won't benefit you, and it will make it worse.
Right, but have that credit card handy just in case.
Yeah, of course. I'll have Ellen standing right there.
I think Ellen's already like ringing that thing up. No, they're good.
She's like, I've got them on auto pay. It's okay.
But when you are you in the offices that also offer, like I've seen a lot of them are getting into Botox and those kind of injection things.
Yeah.
Did you guys do that as well?
Yes.
And are you seeing a lot of people that are coming in, like, I only know, I used to have a client that was a plastic surgery center.
Okay.
And I would see the before and after. You know, it kind of looked like these people would come in, it looked like they were in severe
look
pain.
like cats, right?
Yeah, well, it's like the Easter Island thing. You know, they couldn't move their face, but it was like they were so happy because they didn't know wrinkles. Is that the new trend? Is that dentists are getting into that because they have steady hands and they know how to inject?
Well, we do give a lot of injections. Remember, we're one of the few, really, doctors that give injections consistently. You know, medical doctors don't give injections unless they're plastic surgeons or whatever.
They give you notes.
But
Here, get these pills.
But mostly nurses do it for them. But I inject quite a bit in the mouth, so it was a no-brainer. Plus, some people don't want people to know that they're getting Botox. So it's an easy way to kind of hide that they're getting it done. I like the more relaxed look. I don't like the frozen look. So you just come out looking a little bit more refreshed.
I like the permanently scared look, where their eyes are wide open.
I can do that, or angry, like permanently angry.
Yeah, like they're confused. They're thinking really hard, and they're like, "Do I like my molars? Yes, I do."
Botox is a thing, though.
I did read that. I almost brought that in today because I was like, "Why would a man want to get his face shot up?" Have you done that?
To myself?
Not to yourself. Obviously, people will see on Facebook that you're not all
very
Botox,
wrinkly.
though. That's not what I mean. I mean, you're getting up there in age, sure. You're on the
I'm
40 under 40. You're on the 40 under
40.
40. When is that again? When do you leave for that?
End of May.
Okay. So we got a few shows to pump that up before, and then that
Yeah.
issue will come out. And everybody go get Incisal magazine.
Incisal Edge.
It does not matter. Could someone buy that at a store?
What if there's an Incisal magazine?
If I go to
they got the wrong magazine.
You could
Then
be in
I
that
wouldn't
one
be
too.
in it. They
You're
would-
not
they
really
would
thinking
do-
ahead. We just plugged them, so now they're gonna know. I gotta get this woman has a radio show that's under 40 years old, could be on the show.
Okay.
And she's
well,
Botox.
It's Incisal Edge, and I do Botox.
Okay, but
And
my question
Botox.
is, have you done Botox yet?
No. Guys are a little timid, but they will come once their girlfriends come, and wives.
Really?
I guarantee it.
So it kind of works the same way as dentistry. If
Yeah.
you can get the female to come, the male will come along.
I'll just make an appointment for you. You can show up.
Yeah, I just want it in one eyebrow. I just want one eyebrow constantly raised.
Just raised? Okay.
Yeah, so it looks like I'm really...
And the other one, I'll depress it.
Yeah, like I'm thinking hard about what you're saying, but I'm really not listening.
Okay. Well, that's like every day.
What'd you say? Oh. Well, I think, in the remaining parts of this show that we have left, which is not much, I just want to get your overall feel about, when you're treating people and you see the decay. Like, I learned something brand new today, and I know you could get cavities in between your teeth. But when you're seeing these patients that are coming in based on, because you said you're getting a lot of calls these days, right?
Yes, we are.
So there's nothing to fear if you do have cavities, if you do have these issues. You're not going to judge anybody.
No, of course not.
But you will give them a little, like, hey, you might want to cut back on this.
Yeah.
So you're not going to take it away.
No. You don't have to completely take it away. You just have to cut down.
I feel like you're very open to letting people, like, live their life.
You have to. Life is short. You can't. I eat candy. I mean,
You should. You're a dentist that just admitted to eating candy.
Eat candy and chocolates.
They're going to
And I
revoke
drink
both your
apple
medical
juice
license.
occasionally.
Oh my god, that's got to be the worst.
I
That's got to be
haven't
worse than Mountain Dew.
I don't know.
That's like pure
let's do
sugar.
a science, and we can do
We
it.
should do that.
We'll do
You
it.
should do that on Instagram with your hygienist.
I'll put it on each of your teeth. A little drop of Mountain Dew and a little drop of apple juice,
not the
and see
guinea
which
pig.
one decays
I think we
faster.
get your hygienist
I think
together and do a little Instagram video so people can see. That'd be interesting to know how much sugar is in apple juice, which we're giving our kids, versus Mountain
Well, they
Dew.
do say to water it down.
Who said? Who says
People.
that?
They.
Oh, just people?
Just
they?
People.
Just people.
People.
Okay, good. I feel we've ended this show on a high
Professional
note.
people.
We started off so good. And then this is how we're going to end the show for the week. That's
There's
all
always there's something each week though.
Yeah, it's a highlight. That's all we have time for. Why don't you send us home for the week?
Thank you for listening to the River Park Dental Show. You can see us or contact us at 614-689-8686 or visit our website at riverparkdental.com. I totally flubbed that.
Every day with the chocolate.
Again, that's riverparkdental.com.
Every day.
riverparkdental.com.